The content of this podcast is for informational purposes only and should not be considered medical advice. Always consult with a qualified healthcare professional for any health concerns. Take care of yourself out there.
Welcome to Unravelling. This is a podcast that sees the world through the lens of mental health. I'm Mary Wilson, a former journalist.
And I'm Kurt White, a social worker and psychotherapist.
And we want to let you know that our next two episodes are all about suicide. And that's because September is Suicide Prevention Month. And we're actually dropping this episode a day early if you're listening to it on the day it publishes. September 10th is World Suicide Prevention Day. So it's a really important topic we want to cover, Kurt, but we know it's not an easy one.
No, it's a tough topic. I think both for professionals and just people in the world. It's a subject we don't talk a lot about. But psychotherapists actually do spend a lot of time thinking about it. We're sort of obligated to do that because we're aware that this risk exists in the world. And part of our charge as professionals is to try to help people not die by suicide, not attempt suicide, to have less distress about suicidal thinking, which can be very difficult. But even in the field, sometimes it's not talked about, I think, as much as it should be. And it certainly isn't in the rest of the world, where it's a bit taboo, isn't it?
Oh, it's very taboo. It's one of those words you try to avoid if at all possible. But the guest that you spoke with today will kind of teach us why it's important to have these conversations. And he's a colleague of yours, right, who actually struggled with speaking about this in his personal life while he was also involved with it professionally.
That's right. Kirk Woodring is a longtime colleague of mine. We've worked together on and off over the years, in a number of different settings, here at Brattleboro Retreat, but also before that. Initially, I met him actually when I was just finishing graduate school, and he hired me in my first job out of graduate school. He was running a mental health crisis team, and I joined as a clinician on that team. I worked on overnights, taking calls and going out to see people who were in an emergency room and maybe had just attempted suicide. That was sort of what I did, 2-3 encounters like that all day, every day. And he did that too, and so did the whole team. So it was a real sort of introduction to the field through the lens of working with people with really significant and extraordinary struggles with suicide. And then as I sort of came to know him and taught with him and became friendly with him over time, I realized he also had a powerful set of personal stories that as a sort of arc of his whole life that related to this difficult to talk about issue of suicide also.
And in working alongside him, you weren't aware at the time that this was a really personal topic for him.
No, I wasn't aware of that at all, not until much later. And we'll talk about that a bit as he shares some of his personal and professional experience very generously as we try to figure out how we might begin to talk about these issues that there's so much resistance to even acknowledging in the world at large.
Yeah, and Kirk has extensive experience in this field. Kirk Woodring is a licensed social worker. He's the vice president of ambulatory and community programs for Beth Israel Lahey Behavioral Services. Formerly the vice president of behavioral health for the Los Angeles-based Prospect Medical Holdings, adjunct professor at the Smith College School for Social Work for 22 years, authored several articles and publications, including a book assessing the risk suicidal behavior in the hospital environment of care. Also a TED Talk in 2019 called Speaking of Suicide, and that's used by educators across the country to discuss the impact of suicide. He resides in Deerfield, Massachusetts.
And he joined us here today to talk. Let's have a listen. Kirk Woodring, thank you so much for joining us today on Unravelling to talk about this complicated issue of suicide.
Well, Kurt, thanks so much for having me.
When we started to talk about the idea of trying to talk about some of these heavier topics like suicide and, loss. We've done some work on loss. I thought of you right away, because a lot of it's a lot of how I came to know you was through that as a particular area of focus for you.
Yeah.
And so maybe just start at the beginning. And how did you first become aware of suicide as an issue to be thought about, maybe even just in your personal life?
Really, the first time I really became aware of suicide was probably in high school. I grew up in a small town in Michigan, and very small town. And in that town, during my high school years, we had, I think, 4 people who died by suicide. And it wasn't talked about. Nobody talked about it. We talked about the deaths, but we didn't talk about how the folks died. And then when I was in college, I think I was probably a sophomore in college, my brother, who was 15, made an attempt. And it was a pretty serious attempt. It's kind of a wake-up call for me. It's like, again, suicide, we're not talking about it. And even in my family, I think it was not discussed. And so over time, I became really aware of the presence of suicide all through college, and then into my adult years. I started, before I became a social worker, I was doing work with men with AIDS in mid-Michigan, and it was at a time when people were dying from AIDS, and they were also dying by suicide as a way, I think in many ways, to prevent the pain and suffering that they experienced with AIDS. And all of that, I think, led me to becoming a social worker in many ways. Ended up, as you know, running a crisis team for a number of years where we saw suicide all the time, or saw suicide attempts all the time. So, it's been in my life for a long time and became even more present when my brother ended up dying by suicide after a number of years of attempts and rehearsals at suicide.
Yeah. How was working on a crisis team? How did that influence your thinking about suicide?
Well, I think professionally, for me anyway, there was this disconnect between professional and personal. And so all this time that I was, working on a crisis team and working with clinicians doing crisis work, my brother was still suicidal. And for a number of years, over the course of probably 20 years, continued to practice suicide, rehearse suicide. And it was interesting to me as I look back now to think about how I could talk about suicide every day with my clinicians and in kind of a clinical way, but in a personal way to actually talk with my brother about suicide and have a conversation with him about that. It was very difficult and I think I was afraid of what might happen if I had that conversation with him. And I think that's common for most people to avoid those conversations. And I think that's why we don't really talk about suicide. We have our own fears about that.
That's actually just what I was going to ask you about. What do you think makes it so hard to talk about?
I think there's this, for some folks, there's a belief that if I talk about it, it's going to make it happen, which is, scientifically not true. I mean, there's nothing in the literature that suggests that if you have a conversation about suicide that you're going to create suicidality in somebody. I think it goes deeper than that. I think it's really about our own fear of our own suicidality and the fact that we ourselves could feel suicidal, that we ourselves have questions about that. And I think that to talk to other people about that, about suicide, then brings that up. So I think it's both, right? It's our own fear about our own vulnerability to suicide and the fear in others as well.
Yep. I mean, I always sort of appreciated that, like in Durkheim or something like that, something that turns it on its end. Why don't we commit suicide? Might be actually the more salient thing, right? We have to actually choose not to do that every day, I suppose, right? We have to choose how to make a life, and maybe that's not so easy to do.
And for a lot of folks, it's not so easy to do it. I mean, I'm not going to say it's easy for people to make the decision to die by suicide, but I think it's an option that we don't talk about much with each other, and we don't have these conversations. And I think, if people could connect around having discussions about suicide and about thoughts of suicide and suicidality in almost a conversational way, then it takes some of that stigma away from that. And in fact, what it does then is it opens up really opportunities to have conversations about it. People don't feel like they're holding on to that feeling that I think that I want to die. I think that I think I could potentially take my life, because I'm actually beginning to have conversations with people. And it's not necessarily always the professionals that you want to have conversations with. Sometimes it is family members. Sometimes it is friends. Sometimes it is, folks that you maybe don't even know very well. Crisis team, call centers, do very good work around having those conversations. So I think that's a piece.
Yeah. It's interesting because a lot of people think of suicide as something exclusively related to depression, but actually that's really not so, is it?
No, it really isn't. And in fact, folks that think about suicide and plan suicide often do that over a long period of time. It's not an instantaneous thing. It's not a decision that I'm going to do this right now and then I do it. That does happen, but I think more often it's with folks who have been thinking about this. And it's not necessarily depression. It's not necessarily even other mental illnesses, although it can be, and it often is. But I think that it's more of kind of an existential angst that people have. And in fact, I think that's one of the reasons we're seeing suicide rates increase.
It's been on the rise for over 20 years, I think, actually almost 25 years, I think, a sort of steady increase. It's one of the more sort of upsetting trends when I think about things in the mental health field.
Yeah. Despite the fact that there are resources that have been put in place to try and slow that down. And so I do think that this existential component, like the fact that we're struggling, all of us are struggling, we all struggle, right? And that struggle really does weigh on us. So the weight that we have, the pace of life, all of that, makes suicide an option for some people, and it makes it, a possibility when it might not necessarily have been at other times.
What do you think is the relationship to larger social forces and inequities, for example? Is there a connection there also?
Oh, I mean, statistically there certainly is, and we look at, race and ethnicity as factors. We look at certainly poverty. Interestingly, there are groups that one would think may be more likely to engage in suicidal behavior, but aren't. And I think that has to do with the social supports that exist within the community. I think communities that we know have greater social supports, greater connection maybe to churches or to community resources, are less likely to actually die by suicide. It's often folks who feel disconnected from those social resources and those social supports and that community that they're really at a greater risk. And I think one of the things that happened with COVID is that we saw a significant isolation amongst everybody, but certain groups, older adults particularly, had this profound isolation. And we've seen increases in suicide rates with older adults go, kind of skyrocket. And so I think there are particular demographics that are more prone to suicide, but not necessarily the ones that you would think of.
Yeah. And they're often, sometimes providers like us, we get asked to weigh in on how to reduce suicide. And I sometimes find myself right at the same nexus that you're describing here, which is that maybe some of the root causes are things that go far beyond the reach of like a mental health system.
Yeah. It's interesting because my organization is involved in Zero Suicide initiative. And one of the things that we do is we do a Columbia Suicide Severity Index, with everybody that we see, every clinical engagement we have. We do have these initiatives to try and make a difference, but I'm not sure that they always work very well, and I'm not sure that they're directed in the right way. The story I love to tell is I went to see my physician for a physical. This was a couple of years ago, at a time that I was doing a lot of writing on suicide, and the tech came in and was doing kind of a pre-screening and was asking me questions. And one of them was, actually what she said was, "You don't think about suicide, do you?" Which is an interesting way to say it, right? And I said, "Yeah, actually I do. I think about it every day." And there was this pause and this blank look, and then kind of a look of horror on her face. And she said, "Just a minute, let me go get the doctor." So she went and got the doctor, and he came in, And he said, "So you think about suicide?" I said, "I think about it all the time because I'm writing about it. I'm working in that. I have family members that have died by suicide, and so yeah, I do. I think about it. But I think for us, we ended up having a conversation about how we just sort of push aside the answers even when we do a screening, and we don't necessarily take it seriously. We don't really know how to have those follow-up conversations. So engaging in conversations and broadening the dialogue around suicide, I think, is really where it's important to go.
And it sounds like it starts on the one hand with just acknowledging that suicide exists, and actually this is not such an unusual phenomenon in our society.
Yeah, for me, maybe I'm in a bit of a unique situation because I've been trained in how to do this work and how to ask questions and how to have conversations. And I also have the experience of not asking those questions in my personal life with people I care about. And I think that gap there takes some bridging for me and probably does for everybody. I experienced this with somebody I care about a couple of weeks ago, someone who I could tell was struggling. I know is in a high risk category for suicide. And despite that, and despite the fact that I talk to people about suicide all the time, it was very difficult for me to engage him in a conversation about that. I think, I had to look at that. Like, what is that about? And I think it's my own fear of talking about it because, it might bring up stuff for me, my own vulnerability around suicide.
And, you've alluded a couple times, I think, to just how maybe it actually isn't so unusual that people would at some point in their lives have some level of thinking about suicide, maybe even about their own suicide.
Sure. I think most of us have. Anecdotally, almost everybody that I've talked to in my life, when I talk about suicide, has had some experience of feeling suicidal. Often it happens in adolescence, when we're struggling with how to be resilient when things are really difficult. And it goes throughout life. And then, at the end of life, towards the end of life, when we lose things, lose communities, lose people that we care about, older adults are at a much higher risk for suicide than any other demographic.
So how can people normalize talking about suicide with people in their lives?
Yeah.
How do we bring it up?
It's a good thing to practice. Even in training that I do with mental health professionals, psychiatrists, psychologists, social workers, nurses, I've gone through a full day of training and then go to the practice part where we're having conversations and, we break down into pairs or triads. And I'm listening to hear, are people talking, are they actually using the word suicide? Are they asking questions directly about suicide risk? And about 75% of the time, they're not. Even though they've spent a day listening to how to ask questions about suicide, they're not. So it really is kind of going beyond that sense of discomfort that we have around it. And I think we have to practice those conversations. We have to practice using the word suicide.
Yeah, I love that you're saying this because I think there's such a taboo about this. It's so hard to raise that even myself, as someone who spent a lot of time thinking about it, I have trouble thinking like, what would the actual words in my mouth be? What might you actually say? Maybe role play with me. What would you say to me?
Yeah. Well, okay. So let's do that. I'm wondering, Kurt, given all the stress that you have in your current life, job, right? It's there, right? I wonder how often you think about, just maybe even in the back of your head, about dying by suicide. I wonder how often it comes up for you. It wouldn't be unusual for you to be thinking about having thoughts of suicide or about dying. And I wonder how often that actually comes into your life or comes into kind of is present for you.
Yeah. See, I know I notice as you say that to me that I just feel really relaxed. Actually, like you've sort of created a permission structure for me to really be able to. Like, I feel like I could answer you, I could really sort of get into just sort of like you've asked me a very important thing, but also in a very normal thing.
I think that's the piece that really matters, right? It's that normalization. It's normalizing something that is taboo, stigmatized. So the more comfortable I can be or you can be in talking about something that promotes a normal kind of condition, I think I said it wouldn't be unusual for you to feel this way, right?
And there's a real trick to balancing, I think, the seeing and respecting that this is a whole person with a whole life, and thinking about suicide or even maybe seriously considering suicide is only a small piece of that.
It's one piece of it, right? It can be a huge piece, right? I mean, it can be a very important piece, but it's not the entire person. In most cases, that's not what is kind of what their life is about. But it is if it's present in their life, then it's an important piece to really consider and to talk about.
I've often noticed that it's a theme across mental health in general, that it's very often the things that we can't talk about that we really end up suffering from.
Yeah. And it's those pieces that are the doorknob comments, right? As the person's going out the door of the office, oh, by the way, I am thinking about killing myself. Have a good week, and I'll see you next week, right? How do we handle that? We handle it by having those conversations earlier on in our sessions, earlier on in the relationship, so that it doesn't become that doorknob comment.
Yeah. And it's very tricky. I think I'm sort of, as you say this, I'm reflecting back, and I can think of 2 coworkers I had over the years that died by suicide, and the way the mind goes back to what might have been different, and I think that's one of the challenging things about suicide in a way, isn't it? That way that we sort of try to think about what else might we have done.
In a way that is, I think, different than almost any other death. When somebody does something to take their own life, I often kind of perseverate on what could I have done? How could I have done something differently? How could I have intervened? If only I had done this. And sometimes there are opportunities that have been given to do that, and sometimes there aren't. But I do think that it's one of the things that we struggle with mightily as therapists, both for and with our clients, but also with our colleagues. And as you said, people that we work with, they die by suicide as well.
And I'd like to get back to, you've talked about your brother a few times, and that as sort of something like on one layer in your life, this was this struggle of his, which sounds like a long-term struggle, was a big part of your life for a long time.
Yeah.
And I've known you a long time. I didn't know actually when I first met you that was true, and the rest. And
yeah, right.
And I wonder if you could tell us a little about that.
Yeah,
about him.
Yeah, I mean, the trajectory for Kyle was one where I think he always felt a little different from others. He was an amazing musician, percussionist, drummer, even starting very young. And I remember my mother saying when he got his first drum set, I think he was 4 years old, and she said, he marches to the beat of a different drummer, which was true for his entire life. And so I think he struggled with depression, but I don't think depression was a driving force or driving factor necessarily in his suicidality. I think that feeling disconnected from others might have been, although he was very involved in social relationships. He played music very well throughout his life and recorded and toured with some amazing musicians and bands and individuals. He played jazz. He played rock music and country music and was quite proficient and quite well known in the music industry. And yet he always felt a little bit different, like he just couldn't quite connect. And I think he would talk about having demons, and I probably could have had more conversations with him about what those demons actually were or how he, felt about those, but I didn't. But I think ultimately, through his life, we would see him go at times be doing very well, and then suddenly he would kind of crash, and he would make an attempt on his life. We did try intervening at one point because he was drinking alcohol quite heavily at one point, and we did try to have an intervention, a family intervention, and it just didn't go well because I think in large part we were all afraid to really confront him and talk about the alcohol use, but certainly nobody wanted to talk about suicidality, despite the fact that he had a history of attempts that we were aware of. And me included, it was I didn't want to broach that subject with him for whatever reason. And so, ultimately at a point in time when he was really at, I think, the pinnacle of his career in many ways, was doing very well, had a family, had a son at the time who was 13, he made the decision to end his life. And he did it in a way that he had probably rehearsed before and practiced. And it was, I think, devastating to everybody because people who knew him but didn't know him that well were just shocked. He was somebody that people loved and was engaged socially. And yet those of us who knew him very well were not that surprised. We knew that this was probably coming at one point in time.
How has his death by suicide affected the way that you think about suicide, but also live your life and think about your own professional life and your own mortality and day-to-day life? I'd be interested in all of that.
Yeah, well, I think it's clearly affected me profoundly. I think professionally, I'm more attuned to nuanced suicidality in the clients that I see. I think that's probably true in my personal relationships as well. I think I tend to notice when somebody is just acting differently and maybe suicidal, and maybe some of that is probably my own projection. I think for myself personally, I do have to think about like my own suicidality, like my own risk of suicide. First generation family members are at higher risk than probably any other group. And so I do have to really pay attention to that. I don't find myself being suicidal, but I recognize that there can be influences and times when it might lead to that. And so I just have to be careful and just have to think about that and be aware that, of how I can decrease my levels of stress, social interactions, intimate relationships that matter to me, making sure that I reach out to people that I care about and to let them know when I'm struggling. And I think that's really important. I think it's important for everybody, but it's particularly important for folks who have had a loved one that they've lost to suicide. Just really being aware of your own risk of suicide.
I think that's so important. I think it's a thing that gets said sometimes, but I think it's the actualization of it is kind of hard, isn't it?
It is.
It really means thinking of our own and of our loved ones' vulnerabilities in a more active way, in an everyday active way.
Yeah, I think active is the key word there, right? Having to be active, having to actually be mindful about thinking about it, and not just for ourselves, but clearly for other people as well. I think it's important when we're thinking about relationships that we have with each other and paying attention to the risk of suicide. We think about Thomas Joyner, who is a well-known psychologist, probably the leader in the academic world of suicide right now. He talks about kind of three things that have to occur. There's this sense of being a burden, a sense of not belonging, that social isolation, and then having the capability to actually make the attempt. So not being afraid, I think, is a big piece, right? So I think when we're having conversations and when we're talking with folks and we're thinking about our relationships, I'm paying attention to those things. Like, does somebody feel like they're a burden? And do they feel like they're becoming more of a burden? Have they lost their job and so they don't have the finances? Are they at a point where they've retired and so they don't have, so they're more socially isolated? They don't have that connection to other folks. And then are they not afraid of dying? And then addressing that, if it's true, if that's there, then how do I help them find some support? Whether that's through church, community, there are lots of ways to get support in that we don't necessarily always engage in.
What would you want someone who's thinking about suicide to really know is true, that might not feel true to them in the way of thinking that they have in that moment?
Yeah, I think the biggest thing is that you're not alone. Not only in your feeling about wanting to die, but you're not alone in the world. As much as one feels alone, or as much as one feels like they're a burden on others, they're not. And there are ways to help them not be a burden. They may feel that way, and it may, to some extent, it may be true. Maybe they are a burden. Maybe they are socially isolated, but it doesn't have to be forever. It's a feeling that you're having now, and there are ways that we can help you not feel that. And if we don't get you to not feel that, then you're going to feel it more and more and more. So let's think about ways that you can feel differently, and you're not alone. Call the suicide hotline, call 988, and talk to somebody who's actually been in the situation that you've been in, who understands and has some empathy for that. I think that empathic attunement and connection is absolutely critical, and unfortunately, it's missing. I think more now than ever.
I think I'd also like to just note that treatment really does help. The mental health system can't necessarily solve all of the problems of the world, or necessarily do a perfect job of preventing suicide. That's a lot to ask. But I do think many people find relief from asking for help, right?
Absolutely. Yeah. Again, what is treatment in many ways but a conversation and a connection to somebody who is willing to listen and talk. As long as we as practitioners are able and willing to have those conversations, I think that's key.
Excellent. Well, thank you so much for joining us today and talking about this. That's really wonderful.
Yeah. Thank you, Kurt. It's good to see you.
Good to see you too. So joining me again now is Mary Wilson, who's been listening along in this interview. Hello again, Mary.
Hello. Wow, what a great conversation. It was so tough to hear Kirk talk about how he sort of wishes he said more to his brother, and that still sticks with him now.
It's a particular tragedy of suicide that I think it feels like it should be preventable, and yet it's actually hard to prevent, right? We never stop trying to prevent, but doing so 100% of the time is such a difficult thing. I think that, Kirk gets into talking about some of the most important issues related to this whole topic, including just how isolated a person often feels when they're having a suicidal crisis, and how the rest of the world feels totally closed off to them in those moments. It's a kind of a narrowing of perspective that I think is part of what leads people to want to escape this enormous pain that they're in. But of course, there is a larger picture, isn't there? I mean, we're always trying to do, as Kirk says, is to find a way to unearth some way to talk about this, to put words to it, to shine a little bit of light in the darkness.
And it's not just in having those conversations and being open to having the conversations, which are so hard to have, but also knowing the language to use and the way to frame it. That's why next episode, Kurt, we're going to continue this topic, but talk about how we can really talk about suicide.
I can't wait. That sounds like a really interesting interview, and I'm excited to listen to it.
And we do want to remind people that the best way to get help if you're feeling like you need to talk to someone is just by simply dialing 988, or you can even text 988. That's the Suicide and Crisis Lifeline. You can head to their website too, 988lifeline.org, or the American Foundation for Suicide Prevention, which you can find at afsp.org.
And that site has plenty of resources for practitioners and family members and others. So I do hope people check it out.
Absolutely.
Well, thank you again, Mary.
Yes, thank you, Kurt. And thank you again to our guest, Kirk. And we'll see you next time.
See you next time. Unravelling is brought to you by Brattleboro Retreat and is produced by Charts and Leisure.
Find us on social media by searching Brattleboro Retreat. Brattleboro Retreat is committed to exploring diverse perspectives on mental health. While we invite hosts and guests to share their insights, the views expressed are their own and do not necessarily reflect the policies or positions of the hospital or its staff.